Lack of adequate space is compromising the quality of healthcare at the Konfanochi Teaching Hospital. Data from the National Ambulance Service suggests the hospital receives more emergency cases than any other hospital in the country. Meanwhile, Joy News checks suggest wards at the Accident and Emergency Center, designed to accommodate 12 patients on the average, houses over 40 patients now, with some receiving treatment on the floor. The head of public relations at the facility, Frimpong, says until resources are improved, quality health care cannot be guaranteed.
Next year, the hospital will be 70 years since it started operating. This is a hospital that was built for less than 500 beds, and we are now counting about 1,200. Same space, but the beds have increased. So the hospitals are the dual problem with age, because naturally, when you put up a structure for 70 years, if you even don't do anything at all to it, it will still deteriorate.
So in the last 70 years, there's not been any kind of rehabilitation?
Never been any comprehensive renovation of the hospital. Despite its constant use. I've told you about the numbers in terms of beds, the progression that we've recorded over the years. For 500, we are now heading around 1,200, 1,300. What has happened is that we've rather compressed the utilization of the space. So instead of an area where we will usually put a bed, we are now putting 2. If you're supposed to put 10 beds, we are now putting 20. And so because the hospital has not seen any expansion. So overutilization has also taken a very heavy toll. Ashanti region has been, over the years, one of the most populous regions. In fact, it was the leading or the most populous region in Ghana until the 2020 population census, when Greater Accra came at her. Now, Konfanochi has remained the only hospital all these years. All the programs that were intended to expand the infrastructure never succeeded. A typical example is the maternity children's block, 950 bed, for 47 years. We couldn't even finish it. Way back in 1976, they realized that the catchment area of the hospital was expanding, and the clientele base was also growing, so there was a need to expand the facilities. Unfortunately, we never had that benefit. So the existing infrastructure, we've been compelled to use it for the same population that may be twice the space that we are using now.
Well, I've been joined by the head of public relations at the Kwame Nkrumah KATH, Konfanochi Teaching Hospital. I beg your pardon. Kwame Frimpong, he has more on this. Mr. Kwame Frimpong, I'm grateful for your time. Now, I need you to paint a picture of what exactly we are dealing with in terms of space at the Konfanochi Teaching Hospital. Hello, Mr. Kwame.
It is said that hospitals have a no-bed syndrome, but at KATH, it's more of a no-space syndrome. This hospital was constructed 70 years ago for a specific population size. The population has increased over the years, but the infrastructure has remained the same. Regrettably, unlike Greater Accra, where there are complementary or ancillary facilities to help Kolebu, for instance, if you come to Ashanti region, you don't have that same situation existing. So KATH has remained the sole tertiary facility for all this while, and all the cases are ending up here. So it is a very common sight to see very congested wards when you come to the Accident Emergency Center, for instance. And as I indicated the last time, if you go to the orange, which was built for 12, we now have about 40, 42 beds with patients. All the beds are fully occupied. So imagine a space that was built for 12. But we've managed to procure beds and added to the same space. So we come to the hospital where a bed was supposed to be. We count up to 2 or 3. And in this classic example of orange, we may count up to 4 for a space that was supposed to take just a bed or 2. So Konfanochi Teaching Hospital is actually in that need of expansion, in that need of modernization, because the pressure is set that even our equipment, it keep breaking down around the clock. If you should come to the Accident Emergency Center now, or virtually all the special beds that are being used for patient care needs replacement. All the beds must be replaced, and the same goes with other facilities, the ventilators, for patient monitors, and so because there's so much pressure on us. You know, we are about the most accessible hospital in Ghana, given our location in this part of the country. And so we receive a lot of cases. In fact, from our records, up to 12 regions. All the regions that are surrounded, it's easier for them to get to us than to go to, for instance, Accra. And so there's a lot of pressure on this hospital, but regrettably, we've not had the benefit of any expansion or comprehensive renovation over the years, and that is one of the major causes of the congestion that we are witnessing at the hospital.
And aside the issue of space, definitely there are other issues you are having to deal with. Recently, we heard about lack of machines for dialysis treatment and all of that.
Yeah, that is true. There is a comprehensive plan to rectify that situation, but we need a lot of support from the state because dialysis machines and running dialysis services, these are very expensive ventures. We have currently signed a contract for the supply of 3 new dialysis in addition to 6 months of consumables, and that is costing us in the region of 1.6 million. Now, when we do some of these arrangements, and the funding source is not a social one, but a commercial one, and you have a very suppressed way of setting tariffs in this country when you're a public hospital. It becomes very difficult for us to get the money to pay back this investment that we are making. That is one of the reasons why when we come here, we are unable to replace some of the equipment that break down after we've used them over the years to provide service, because the tariff structure is said that you may only be able to recover the cost of operation and then maybe the cost of maintenance, but not necessarily the cost of replacement, which is very expensive. We are doing a comprehensive renovation and expansion of our dialysis center. So we close the whole dialysis center down. By the end of the month, we should be ready to start operating it. We are expecting the new dialysis machines to be in country by the end of the month, and hopefully by the first part of April, we should have these new machines operational. We now have the capacity to double the existing space that we have, and that is going to give us the opportunity to stock in excess of about 16 machines. We already have 2 in the system. Recently, Springfield gave us 2 refurbished ones, and so that will be up to 7. And we still think that we will need public support in terms of new machines so that we can deliver quality services to kidney patients who come to this hospital.
Back to the issue of, okay, go ahead.
I was trying to say that this country has a certain policy, and the policy is that issues of capital expenditure, our capital investment, are that of the state. And so, for instance, this equipment shouldn't have been bought by us because it is a commercial arrangement, and therefore we need a certain tariff structure to be able to recover fully. Now, if we are to go that way, then it means that the tariff structure will have to be changed. Unfortunately, we are not in control of that. It's the state that sets the structure. Now, if you don't do a lot more social funding of these acquisitions, a time may come, we will not be able to maintain even the one that we have now, because we will not be generating enough to pay for the consumables, to pay for maintenance, and eventually, when they break down, to pay for replacement.
And especially with regards to the issue of congestion, which you alluded to earlier, have you lodged any complaint? And if you have, what has the health ministry done about this so far?
Per the health ministry's own records, Ashanti region is the least served in terms of health infrastructure. That is not in doubt. It's something that has been known for years. We have very few purpose-built hospitals in this region, even though for decades it was the most populous region. And so they know that one, we have issues in terms of numbers, we have issues in terms of sizes, and we have issues in terms of capacity. We always say that Konfront is 1,200 bed. Its counterpart in the Greater Accra is Kolegu. Kolegu is about 50% bigger than Konfront. Now, Tech or KNUSU Hospital has about 100 beds. Its counterpart in Accra is a UGMC. It has over 400 beds. If you go to the Kumasi South Hospital, which is the acting, because we don't have a regional hospital, the most populous region in Ghana, yet we don't have a regional hospital. Kumasi South Hospital, which is the acting regional hospital, has 150 beds. This is the counterpart in Accra, rate has almost 400 beds. So these are data that is available, it has been available for years, and the ministry and the authorities are in the know. And so if it is happening, it's not for lack of knowledge or awareness. It is simply a question of disparities in infrastructure development as far as the health sector is concerned in this country.
So how do you intend to resolve this issue now that the ministry hasn't really done anything about it? Are you going to sit down and fold your arms?
No, and that is one of the reasons why we are doing some of the advocacy we are doing it now, because it is impacting negatively even on our image. People expect Konfanoche to be in a position to admit ad infinitum. They think that we have infinite capacity to admit, and so when they come here and the place is full, it is the hospital that they blame, and not the disparities in the healthcare infrastructure that we are experiencing in this country. And so it is even in the interest of the hospital to do this advocacy, and that's why we've done over the years. On our own, I've told you that we are optimizing the use of the existing space that we have. And that's how come, if you come to the Orange, for instance, a 12-bed capacity, we now have 42 beds, because we've compressed the use of the space in order to allow for more beds to be placed in these areas. We believe that it is about time the region start up and make sure that the upcoming facilities like the Kumeru and the Sewua Regional Hospital, the ferries and the rest, we try as much as possible to impress upon the state to complete those facilities so that we take some of the pressure off us. Since I joined this hospital in 2005, we've had a number of CEOs, but each of them has always resisted the temptation to close down this hospital when it is full, because they think that you are giving the people who are coming here no option because there's no alternative. So on our own, we've tried to soak up the pressure, but it's reached a point where we are putting too much stress on our staff, too much stress on existing facilities, and they keep breaking down, and it is becoming a problem. So we are hoping that as we do the best that we can by optimizing the existing facilities to deliver the best of service, there is the urgent need for this country to take a critical look at health infrastructure in the Ashanti region and make sure that we want to get the needed help that it needs.
Thankfully, I've been joined also by the ranking member on the Health Committee, Kwabena Minta Akando. Mr. Akando, your committee is supposed to ensure that health facilities are in good shape. So what have you been doing all this while? Hello, Mr. Akando. All right, so let me try once again to get your attention. Minta Akando, who is the ranking member on the Health Committee of Parliament. Mr. Akando, your job as a committee is to ensure some of these health facilities are in good shape. What has your committee been doing all this while to get to the point where Konfanoche Teaching Hospital is in this shape? All right, we'll try and get him back on the line to speak to the issues. But thank you so much, Mr. Kwame Frimpong. He is the PRO of KATH. He's been enumerating some of the challenges being faced by the hospital. I'm told that Minta Akando is back on the line. Mr. Akando, your committee, the Health Committee of Parliament, is expected to ensure that some of these health facilities, especially teaching hospitals that serve a large number of constituents, must be in good shape. What has your committee been doing all this while? Right, I think we've lost Minta Akando there. We will try and get him back again on the line, but let's still stick with health issues. Hello, Mr. Akando, can you hear me?
Yeah, good morning.
Right, so I'm asking what the Committee of Health in Parliament has been doing all this while, because we know your job is to ensure some of these health facilities are in good shape. So what have you been doing all this while for us to be witnessing some of these challenges in these hospitals?
The job of Parliament or the Committee on Parliamentary Select Committee on Health is not for the day-to-day running of the hospital. We are there for one, approval of facilities or loans to make sure that hospitals are in good shape. We are there for legislations of these hospitals. And of course, we are there as and when issues come up to try to see what we can do about these things. But you see, the issue at hand is self-inflicted by this government. And I guess we are talking about why we have limited space at Confirmatory Teaching Hospital, isn't it? Isn't it?
True.
Yes, it's a self-inflicted one. There are two main approaches. We must be dealing with assets. And then, apart from the assets, we have to be able to equip our health facilities with the necessary medical equipment. Now, the assets, due to the strategic position of Confirmatory Teaching Hospital, it's expected that pressure will come to bear on them. So if you could recall, His Excellency John Dramani Mohammed's administration made the attempt to reduce the pressure on Confirmatory by constructing a number of health facilities in that environment. So you talk about the Wea, you talk about the Fazi, you talk about Kumawu, you talk about Komena. So if you complete these major hospitals within the enclave, it will automatically reduce the pressure on Confirmatory. That is the idea. While you are looking at expanding Confirmatory, renovating Confirmatory, you are looking at completing these health facilities within the enclave to break down the pressure on Confirmatory. And your guess is as good as mine. For the past 7 to 8 good years, these health facilities, the construction of these health facilities, have come to a halt. You know, and even those already existing ones, for example, even if there is space in Confirmatory and dialysis machines are not working, and you are right to Confirmatory, you may get a bed, but you may not get a dialysis machine. You go to a health facility, and there are no imaging facilities or equipment. These are the problems, and it is the responsibility of the government, the executive, to spend, to invest in the health sector. I'll give you another example. I'm just coming from Samar Hospital. The responsibility of we, the members of parliament, is for government to see the need that, look, let's go and construct a hospital at Samar. So the government brings a facility to parliament, then we approve the facility. Then the government goes ahead to spend, to build. Now, from where I am coming from, 4 years, the president went to Samar to cut a source for the commencement of Samar District Hospital in August 2020. We approved the loan in March 2020, and we are in March 2024. Yet, absolutely nothing is happening on the site. So please, yes, we have a role to play, but we are not a dependent office. And it's our responsibility to bring to attention, to bring to fore, or the front burner, what the people need. And we do our work. If you have monitored the Parliamentary Select Committee on Health carefully, I don't think that we have been quiet in the health sector.
So how do you intend to get the health ministry to actually deal with some of these challenges? As you yourself have heard the PRO of KATH and you've seen visuals, it's really damning.
I didn't hear the question. How do we do what?
I'm saying, how do you intend to get the health ministry to actually deal with these challenges?
Yes, so quite recently, about 2, 3, 4 days ago, I had my chance to take the SONA and ask your reps in Parliament. I showed some of the sick hospitals on the floor of the house. That is the way we can get them to do the right thing. But these are, people who don't really care. They don't care. If you have any responsible government in place, even after airing this news, somebody must be I mean, somebody must be answering some questions. The president or the vice president or the minister must quickly find out what is happening and attend to some of the issues. And look, you people, join me. You need a documentary on sick hospitals. Go back to those hospitals if anything at all has been done. So that's the country we find ourselves in. So we will continue to do our best through some of these interviews, through questions, and inviting the minister responsible for health to appear before the House. Unfortunately, there has been some reshuffle, and the new one has not been cleared to appear before us. But as and when he's cleared, we will tell you about that absolutely.
Grateful for your time. Kwabena Mintah Kando is ranking member on Parliament's Health Committee. Let's